So I think that next generation sequencing has importance in two aspects. So one is to identify the clonality in patients that have slight anemia, that do have normal cytogenetics, and where we are unsure about the clonality of the disease. So for the diagnostics in low-risk disease, it can help to identify clonality. I think that will be something which will be important, especially for younger patients. And sometimes we even see some bad mutations where we need to be we need to know these mutations to have a good follow-up and also decide how to monitor these patients, because they have probably a higher risk to progress into higher risk disease. This is one, I think, important indication. The other is before allotransplant. I think that next generation sequencing is important for two aspects. One is again for the prognostication of the disease, and the other is also for the follow-up. So if you transplant a patient, these mutations can be used to detect minimal residual disease after transplantation, together with all the other diagnostic tools, of course. And then it can also help to decide where we need to add additional treatment after transplant and at what time point. Most of the patients receive a sort of additional treatment after transplant, but I think this can help to identify the relapse of the disease.